I've been involved as a patient research advocate for over 20 years now, and the first thing you need to know is that it is a journey, not a destination. There is no destination to get to. All you need to do, however, is take one step at a time in whatever direction you want to do, at whatever pace you want to do. My journey started when I was diagnosed 22 years ago. Like many of you, cancer wasn't a journey I chose, it chose me. But when I did develop breast cancer, I saw it as a wake-up call, a call to do everything I could to make sure that cancer wouldn't come back, while at the same time making treatment choices that would make my body able to take care of itself on its own. So it was a balancing act, and I had to start advocating and researching for myself. Today, that wake-up call has evolved into a lifelong passion. Unfortunately, my journey with cancer did not stop with me, and 14 years ago, my husband was diagnosed with prostate cancer. It was a very aggressive form of prostate cancer, and we thought we'd caught it early because it didn't appear to have been anywhere outside the prostate. But then 12 years ago, he was diagnosed with metastatic prostate cancer, but wait, there's more. 6 years ago, he was diagnosed with HPV tonsil cancer, and for those of you who've been through that, you know the treatment really sucks. But despite lifelong and life-challenging events and side effects, he remained HPV tonsil-free until January, when metastatic prostate cancer finally took him. And he transitioned into the heavens. And I still believe he's watching over us, because you know somebody needs to watch over me. I learned so much about a lot of different things walking with Jeff and his journey as his co-survivor. I often shared, even early on, that Jeff's journey was harder for me than my own, because for me, I didn't see it as a wake-up call, but Jeff, when he was diagnosed with prostate cancer, when I looked up online, the little I could find said he would be dead in 9 months. Well, that was his prognosis without treatment. So what about with treatment? Well, nobody could tell you. And still today, with metastatic cancer, nobody can really tell you how long you're going to live or not live with metastatic cancer. Case in point, sitting right before you. So anyway, but due to just-in-time new research discoveries, Jeff and I had 12 more years of life together, and he is my why. Jeff is why I'm so passionate about research, as well as the other friends and family members who have been diagnosed and some who have died from cancer. They are what keep me very passionate and very focused on doing the most we can and making sure we get this problem solved earlier than later. My involvement in cancer research advocacy began with volunteering to be an advocate reviewer for Susan G. Komen's research grants. And despite not having any research background, I discovered quickly that my experience and insights added to the discussions. Sometimes it was as simple as asking a question because I didn't understand something. Often the resulting discussion led to the researchers even talking amongst themselves and trying to debate something. I love it when an advocate asks a simple, naive question, and all of a sudden the researchers are discussing among themselves and debating it. Asking questions is a critical skill and important resource for us in our work. Early on in my journey, I was on a grant review panel for breast cancer imaging. The grant being proposed would add another amazing imaging technology, but again, it wouldn't take away a mammogram, it wouldn't take away ultrasound or any other imaging technology that was done at that time. So in other words, the patient would have to endure all of those and then add this to it. At the same time, it was a very expensive piece of equipment. So the researchers were very positive. This was amazing, very elegant research, and they gave it high reviews. And when it came time for my review, I said, it really does sound interesting and great, but the only problem is it wouldn't replace anything that we're doing now. It only simply adds to it. And in adding to it, it adds to the cost for the patient as well as hospitals and physicians. In fact, it would add the cost for the piece of equipment and how to run it and house it and everything else, so that very few hospitals and clinics would be able to afford it. So how many patients would really have access to this piece of equipment once it was developed? And so is that really a high impact? And all of a sudden you could tell by the look on their faces they hadn't really thought that far through things, and they started debating and about it, and they rated their grants, their review scores down. So again, what is the real impact that they are having here? When I first started actually working with researchers on their grant proposals, I mostly focused on helping them explain the research so patients could understand it and relate to it. I focused on what's called the impact statement and then the lay abstracts. Lay abstracts are supposed to be everyday common language. They are often heavy on the lay abstract part and anything but answering the question, why would this research be important to patients? My work as a patient advocate has evolved over time. I seek out education and training. And again, it's a journey. It's not a destination because our only purpose is to serve, purpose is to do the very best we can in every endeavor to represent the patient perspective. We provide advice, knowledge, and wisdom based on living with cancer 24/7. We bring the lived experience to cancer. This slide charts, this is 22 years, guys. This slide charts my major pathways in research advocacy. I'm currently working with a young investigator on his proposal, and I served as mainly an editor and patient perspective expert in his grant. He was successful in getting it. We worked on a poster together, and now that poster has been accepted at an international research grant, research symposium, and we'll be presenting it together next week. So almost always, I want to mention this before, almost always I head into the work with absolutely no idea of what I'm going to be able to contribute, and that used to the jabezies out of me. I worried that I might not be able to contribute anything, but then I quickly learned that if I just sit there and listen very intently and keep patients' perspectives in my heart and mind, I can add to the conversations. If I ask questions to better understand what they're trying to do and how that patients. Again, most often the advice, wisdom, and knowledge we share as advocates is what we view as everyday common sense. No, people don't want to carry around a 24-hour urine jug. I mean, seriously, guys. The opportunities are amazing and rewarding, and the only limits are what you have the passion for, what you have the time, commitment, and the ability to do. It is your choice. All you need to do to get started is to have a desire to make things better for patients. Good communication skills, because we need to help them learn how to communicate. We should be able to communicate with them. Ability to represent all patients, so that's an all that's evolving all the time. You talk with other patients so you know what they're going through. A drive for knowledge, a willingness to learn the basics of research and science, and be curious, ask questions. That's some of the most fun part of all of this. The ability to work collaboratively with others, and for me, a sense of humor always works. So I want to wish you the best for an amazing, inspiring journey, whatever you choose to do.